So the mission of the Global Alliance then is to simply accelerate the process of having a harmonized approach for responsible sharing of genomic and clinical data. This is one of my favorite maps. These are a map of scientific collaborations. It is absolutely beautiful because now you can see the emergence of true international, I never say global, but international collaboration. And I think that's the challenge, that's where we are. We all know how difficult it is to share genomic data. So it doesn't generate or store data, it doesn't do research, it doesn't care for patients, it doesn't interpret genomes, and it doesn't say you must share in order to be a member. It has 4 working groups: a data working group, a clinical working group, a security working group, and an ethics and regulatory working group. Every time someone says, we need to look at this, they create a task team, and a task team does its work, usually 6 to 9 months, gets the product out, and then there's a new task team if there's a new issue. It doesn't exist as a legal entity. It has no money, surprise, surprise. It's simply there to catalyze. It just puts people together that have ideas, and when the work is done, the work is done. The next thought or idea comes up and it goes on. So as I mentioned earlier, it has 344 organizational members. Now organizational members are, you can see them all listed there. There's all different kinds, including Google and Amazon and IT companies, pharma, institutions, research institutes, universities, and so on. Anyone can join as long as you say you will adhere to the Constitution and the framework. That is the only criterion of membership. And instead of using a bioethics declaration, we turn to human rights as found in the Universal Declaration of Human Rights of 1948, Article 27, the right of citizens to benefit from advances in science, and in the same article, the right of scientists to be recognized for their work. There are all these core elements. They don't look like your normal bioethics declaration. They're data sharing priorities, the data sharing elements. And each of them has 2 or 3 procedural mechanisms that come under it. So they're not sitting there naked. They actually have a few indicators of what they mean. The consent one, however, was a real issue. The only way we could get the framework through, or anyone to agree on the framework, was to say, presuming legitimate consent has been obtained, comma, the framework for data sharing, blah, 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 blah. The reason for doing this is as soon as someone said consent is, someone would say, in my country, and then end of story, right? So the framework starts with the presumption that however consent works in your country, for whatever kind of project, all the way from clinical to populational, longitudinal to one-off, if it's legitimately obtained according to the norms of your country, then the framework kicks in. Another policy that just came out is the privacy and security. What's interesting about this privacy and security? One, the security part is all about mechanisms. So for those of you who want simple, understandable security stuff like me, that's the part that you should read because it's a really learning exercise. The privacy part, which you might know better, is really interesting in that it's different. It's different in that it says when you're in data sharing, you are not in clinical trials. You're not implanting devices in people. You're not injecting them with drugs. So if you are an ethics committee or you are an access committee set up for access, be proportionate. In other words, do not use hypothetical risks as your measuring stick. Accountability is not just about sanctions and breaches. It's actually adding to all the traditional kinds of sanctions and what does accountability mean. If you have data that has been consented for sharing, why are you not sharing? So this is looking at data stewards, so-called stewards who sit on data because they're too scared to share it, even if they have consent. Probably the biggest challenge, this ethics review equivalency. Why don't we have transparency, accountability, responsibility, or imputabilité, as we say in French? how can we create a system of ethics review that is efficient, economical, and ethical. So these are real, live, ongoing projects. Beacon. It's sort of like, ding, anybody out there have a genome with an A position at and then ding, there's another beacon somewhere. So it's simply a way of sending out messages, sort of like Morse code, that's the way I look at it. And someone says, yes, I have something with that allele on that position and whatever, and that's it. There's no phenotypic data or any kind of identifiability. It's simply knowing who's doing what, where. The BRCA Challenge wants to build a variation, international, open access, or maybe registered, we don't know, database. They want to build something as rich and better and open compared to Myriad. They want to undo history by doing something positive and putting everything up. We want to have something that anyone in the world can have access to. And finally, the Matchmaker Exchange. What they wanted to do was say, rare disease people want more openness, not less. They don't want to be protected from themselves. They don't want their faces blacked out. They don't want to be privatized, hidden, confidential. They want more sharing, not less. And so they want to be able to do a simple sort of beacon thing, like, hello, anybody out there have a rare disease, like a patient with X or ABC. And when the person answers, then they can get to another level, again, of matchmaking between these different rare disease databases around the world. And just funded is CanShare, which is a Canadian-led project to support all the ethics regulatory work of the Global Alliance. To contact me, just go to www.p3g.org.